What if you could toss your blood pressure pills for good and never look back? It's a question millions are asking. Can high blood pressure actually be cured? Or are you just stuck managing it for life? The internet is full of conflicting claims. Some say you can reverse it with diet. Others insist it's a lifelong condition. Doctors often call it chronic, yet thousands of people say their BP normalized through lifestyle alone. So what's the truth? In this video, we're breaking it down. We'll explore whether high blood pressure is truly curable or just controllable, the difference between remission and cure, what science says about lifestyle, medication, and reversibility, and the real stories behind people who've done it. If you've ever wondered whether you can finally fix your blood pressure permanently, you're in the right place. Let's uncover the facts and separate the myths from the medicine. Understanding high blood pressure. What are we really dealing with? Before we ask if high blood pressure can be cured, we need to truly understand what it is and why it happens in the first place. High blood pressure, also known as hypertension, is when the force of blood against your artery walls is consistently too high. Over time, this increased pressure makes your heart work harder, damages your blood vessels, and increases your risk for serious conditions like heart attacks, strokes, kidney disease, and vision loss. The two types of hypertension. There are two major types of high blood pressure. 1. Primary essential hypertension. This is the most common type, around 90 to 95% of cases. It doesn't have a single cause but is linked to a combination of genetics, aging, unhealthy diet, too much sodium, too little potassium, sedentary lifestyle, obesity, chronic stress, poor sleep. This type develops gradually over time, and it's often described as chronic and incurable. But as we'll see later, that's not always the full picture. Second, hypertension. This is caused by an identifiable underlying condition, such as kidney disease, hormonal disorders, thyroid, adrenal, sleep apnea, certain medications like steroids, NSAIDs, decongestants. In many of these cases, treating the root cause can completely reverse the high blood pressure. More on that in Section 7. The role of genetics. Some people are born with a genetic tendency to develop high blood pressure. If your parents or siblings have it, your risk is higher. However, even in genetic cases, lifestyle still plays a major role in whether or not those genes are activated. Why it's called the silent killer. High blood pressure usually doesn't cause noticeable symptoms. That's why it's nicknamed the silent killer. It can quietly damage your organs for years without you even knowing. By the time symptoms show up, like headaches, dizziness, shortness of breath, or vision problems, damage may already be underway. That's why it's critical to understand and address high BP early, whether or not a cure is possible. Reversible versus irreversible factors. Here's the key to everything in this video. Not all causes of high blood pressure are permanent. Some are structural or genetic, hard to reverse. Some are lifestyle-based, potentially reversible. And some are due to treatable conditions, possibly curable. Whether you can truly cure it depends on what's causing it and how early you take action. Up next, let's answer the core question: is high blood pressure truly a chronic disease, or can it be reversed? Is high blood pressure a chronic disease or a reversible condition? One of the biggest sources of confusion around hypertension is the belief that it's either incurable or easily fixable, with little room in between. But the truth lies in the nuance. Let's break it down. Why it's considered a chronic disease. In most conventional medical settings, high blood pressure is labeled as a chronic condition. This means it often develops gradually over time. There's no quick fix. It requires lifelong management. And if left untreated, it can lead to irreversible organ damage. Doctors often use medications to keep blood pressure in check, especially if it's been elevated for years. These medications don't cure the condition, they control it, like insulin controls diabetes. That said, not everyone needs to stay on medications forever. So why the chronic label? Because in many patients, especially older adults or those with long-standing hypertension, the body and blood vessels adapt to high pressure, the arteries may stiffen, the kidneys may lose function, and the nervous system may become less responsive. At that stage, a full cure may not be realistic, but control is still possible. When high blood pressure is reversible. Here's the good news. In some cases, especially early on, high blood pressure is highly reversible. Let's look at a few real-world examples. Case 1. Lifestyle-induced hypertension. Someone gains weight, eats a high-sodium diet, gets no exercise, sleeps poorly, and starts experiencing rising BP. After switching to a whole food diet, losing 15 pounds, walking daily, sleeping better, and cutting back on processed food, their BP returns to normal. No medications, no flare-ups. This isn't just managed, it's reversed. Case 2. White coat hypertension. Some people only experience high readings in a doctor's office due to anxiety. At home, their BP is perfectly normal. This doesn't require treatment, just proper monitoring and reassurance. It's not a chronic disease, it's a situational response. Case 3. Secondary hypertension. If someone has elevated blood pressure due to a thyroid issue, a kidney problem, or medication side effects, and that root cause is treated or removed, their blood pressure can go back to normal permanently. This is more of a cure than management. So, which one is it? High blood pressure exists on a spectrum. At one end, it's completely reversible, especially when caused by diet, lifestyle, or a treatable condition. At the other end, it becomes chronic and harder to reverse, especially when it's long-standing or caused by irreversible damage. Most people fall somewhere in between, and that's where hope lies. Because while you may not cure it in the traditional sense, you can often reverse the trend, reduce medication dependence, and live symptom-free for years, possibly for life. Next up, what does science actually say about curing or reversing blood pressure through lifestyle and nutrition? What the science says, can people achieve remission? If high blood pressure is often called chronic, does that mean you're stuck with it forever? Not necessarily. More and more research shows that with the right lifestyle changes, some people can normalize their blood pressure and even come off medication entirely. Let's look at the evidence. 1. Weight loss can dramatically reduce BP. A meta-analysis published in The Lancet found that losing just 5 to 10% of body weight can significantly reduce both systolic and diastolic blood pressure. In one study, patients who lost at least 10 pounds had lower blood pressure, required fewer medications, and in some cases went off meds completely. Fat, especially around the abdomen, puts pressure on your arteries and triggers inflammation and insulin resistance, all of which raise BP. Lose weight, and your body often responds positively. 2. The DASH diet can normalize readings. The DASH diet, short for Dietary Approaches to Stop Hypertension, has been extensively studied. It's rich in fruits and vegetables, whole grains, low-fat dairy, lean protein, nuts and seeds, and low in sodium, saturated fat, processed foods. A landmark NIH-funded study showed that following the DASH diet for just 8 weeks led to an average drop of 11 points in systolic BP in people with hypertension. Similar results in those without medication. That's comparable to what some prescription drugs deliver, with 0 side effects. 3. Exercise equals natural BP medicine. According to the American Heart Association, 150 minutes of moderate aerobic exercise per week, like walking, cycling, or swimming, can reduce systolic BP by 4 to 9 millimeters of mercury, improve artery flexibility, decrease stress hormones like cortisol and adrenaline, improve insulin sensitivity. Strength training adds additional benefits when done 2 to 3 times per week. 4. Stress reduction isn't fluff, it's medicine. Chronic stress can trigger your fight-or-flight system daily, elevating blood pressure over time. In a study published in Psychosomatic Medicine, participants who practiced daily deep breathing, mindfulness meditation, or yoga for 12 weeks experienced lower resting blood pressure, reduced sympathetic nervous system activity, improved heart rate variability, and they sustained these benefits months after the study ended. 5. Better sleep equals better blood pressure. In people with sleep apnea or poor sleep habits, Treating the issue often brings BP back into the healthy range. A 2020 review in hypertension research found that those who improved their sleep saw an average drop of 7 millimeters of mercury in systolic pressure. CPAP therapy and sleep apnea. Patients can reduce BP as effectively as medication. Sleep resets your blood vessels and hormonal systems. Ignore it, and BP tends to climb. Prioritize it, and BP often drops. Real-world results. Remission happens. While every person's case is unique, here's the truth. Tens of thousands of people have normalized their blood pressure and kept it there without needing lifelong medication. Doctors now use the word remission more often. Like in diabetes, remission means your numbers are in the healthy range without medical treatment, but you still need to stay consistent to prevent relapse. It's not about a miracle cure, it's about creating the right conditions for your body to heal itself. Next up, what lifestyle changes make this possible, and which ones give the most long-term results? Lifestyle changes that can lead to long-term BP control or remission. If you're wondering whether it's possible to reverse high blood pressure without medication, the answer is often hidden in one key word: lifestyle. The right daily habits can restore your body's balance, support healthy blood vessels, and, in many cases, bring your blood pressure back to normal ranges. Let's explore the changes that science consistently links with long-term results. 1. Adopt a blood pressure-friendly diet. This isn't just about cutting salt, it's about nourishing your arteries. The most effective dietary patterns include plenty of fruits and vegetables, especially leafy greens, beets, and berries. Whole grains like oats, quinoa, and brown rice. Lean proteins, fish, legumes, tofu. Healthy fats, avocados, olive oil, nuts. Low sodium and high potassium intake. The DASH diet and Mediterranean diet have been shown to lower systolic BP by up to 11 millimeters of mercury in some individuals, as much as some medications. 2. Lose excess weight, especially around the waist. Even modest weight loss can make a big impact. Every 1 kilogram, 2.2 pounds of weight loss can reduce blood pressure by 1 millimeter of mercury. Belly fat is especially dangerous. It produces hormones and inflammatory chemicals that spike BP. Aim for gradual, sustainable weight loss, not crash dieting. A healthy weight reduces the workload on your heart and helps your blood vessels function more efficiently. 3. Move your body every day. Physical activity strengthens the heart so it can pump blood with less effort. Recommended 30 minutes of moderate aerobic exercise, brisk walking, biking, swimming, on most days. Add strength training 2 to 3 times per week. This can reduce systolic BP by 4 to 9 millimeters of mercury, and it supports weight loss, better mood, and sleep. Even light activities like standing more, stretching, or gardening contribute to long-term BP control. 4. Master stress, don't let it master you. Chronic stress keeps your body in fight or flight mode, flooding your system with cortisol and adrenaline, 2 hormones that constrict blood vessels and raise BP. Effective tools, deep breathing, like box breathing or 4-7-8 method, mindfulness meditation or prayer, journaling, yoga or Tai Chi, regular nature walks. Daily stress management isn't a luxury, it's a life-saving blood pressure strategy. 5. Fix your sleep habits. Poor sleep quality increases your risk for hypertension. Focus on 7 to 9 hours of consistent sleep, reducing screen time before bed, keeping a cool, dark, quiet bedroom, addressing snoring or sleep apnea if present. Sleep helps reset your blood vessels and nervous system every night. Skipping it increases the risk of sustained high BP. 6. Cut smoking and limit alcohol. Smoking immediately spikes BP and damages arteries. Quitting leads to a measurable drop in BP within weeks. Alcohol can increase BP if consumed in excess. Stick to 1 drink per day for women, 2 for men, or avoid it altogether. 7. Support gut health. Emerging research suggests that the gut-heart connection plays a major role in hypertension. Eating probiotic-rich fermented foods like kimchi, kefir, sauerkraut may improve blood pressure regulation. Prebiotic fibers, like onions, garlic, bananas, and oats, also feed good gut bacteria. A healthier gut equals a calmer immune system equals healthier blood pressure. These lifestyle changes aren't just effective, they're powerful enough to match or exceed the results of medication in many people. Coming up next, should you ever stop taking medications if your BP improves? The role of medications, can you ever stop taking them? If lifestyle changes can normalize blood pressure, do you really need medication? It's a tempting question, and for many the answer is, it depends. Let's break down the role of BP medications and whether you can safely reduce or eliminate them if your health improves. Why medications are prescribed in the first place. Doctors prescribe antihypertensive medications for one critical reason: to prevent damage. High blood pressure is a major risk factor for heart attacks, strokes, kidney failure, aneurysms, vision loss. When BP is consistently high, above 140 over 90 millimeters of mercury, or even lower in high-risk individuals, the immediate priority is to lower it and reduce strain on the cardiovascular system. That's where medication comes in. It works quickly, is often effective, protects you while you work on long-term solutions like lifestyle change. Are medications meant to be forever? Not necessarily. Many people assume that once they start medication, they'll be on it for life. But that's not always true, especially in the following situations. If your high blood pressure was triggered by poor diet, inactivity, obesity, or stress, if you're under 60 with no other complications, if you've made consistent, effective lifestyle changes, if your blood pressure stays consistently normal over several months, in these cases, your doctor may consider weaning you off medication slowly under supervision. The warning: never quit on your own. It's dangerous and potentially deadly to stop BP medications abruptly without medical guidance. Why? Your body may rebound, causing even higher BP, called rebound hypertension. You may be at greater risk for stroke or heart attack during the transition. You may feel fine, but damage could be silently occurring. If you've improved your diet, lost weight, started exercising, and consistently see normal readings, great. Now talk to your doctor about the possibility of tapering off your meds. They may recommend ambulatory blood pressure monitoring, gradual dose reduction, frequent check-ins to monitor progress, adjusting other risk factors like cholesterol or blood sugar. The realistic expectation. Yes, some people do come off medications completely, but others may still need low doses for maintenance, especially as they age. Even if you stay on medication, don't be discouraged. Lifestyle changes still protect your organs, improve your quality of life, and lower your long-term risk, whether or not you need pills. Think of medication as a tool, not a failure. Up next, what if your high BP is caused by something treatable or temporary? Let's explore when blood pressure can actually be cured at the root. When high blood pressure is truly curable. We've talked about managing high blood pressure, possibly reversing it, even reducing medications. But what about actually curing it, not just controlling it? Believe it or not, in some cases, high blood pressure is fully curable, especially when it's caused by a specific underlying issue. This is known as secondary hypertension, and it accounts for about 5 to 10% of all hypertension cases. Let's look at when a real cure is possible. 1. Sleep apnea. One of the most overlooked causes of high blood pressure is obstructive sleep apnea, OSA, a condition where your breathing repeatedly stops during sleep. OSA triggers spikes in blood pressure due to oxygen deprivation, surges of stress hormones, fragmented sleep. The fix? Using a CPAP machine, losing weight, or treating the root of apnea can cure the associated high blood pressure in many patients, sometimes within months. 2. Hormonal imbalances, adrenal or thyroid disorders. Certain hormone-producing tumors or gland disorders can send your blood pressure skyrocketing. Examples include pheochromocytoma, adrenal gland tumor, hyperaldosteronism, too much aldosterone, thyroid disease, hyper or hypothyroidism. In many cases, removing the tumor or treating the imbalance returns blood pressure to normal levels permanently. 3. Kidney disease or artery blockages. The kidneys play a major role in blood pressure control. When arteries leading to the kidneys are narrowed, renal artery stenosis, or when the kidneys themselves are diseased, BP often rises. Treatments may include angioplasty or stenting, surgery, targeted medication. Fixing the underlying kidney issue may bring BP down dramatically and sometimes permanently. 4. Medication-induced hypertension. Some medications, such as steroids, NSAIDs like ibuprofen, decongestants, birth control pills, can cause your BP to rise. If identified early, simply stopping or switching the medication can restore blood pressure to healthy levels. Final thought for this section. These examples prove that high blood pressure isn't always a lifelong sentence. In cases where a treatable condition is the root cause, curing the condition often cures hypertension. That's why proper diagnosis is crucial. Don't just treat the symptom, look deeper. Up next, what if your hypertension isn't curable? That doesn't mean it's hopeless. Let's explore how it can still be powerfully managed when it's not curable, but still controllable. Now let's face the other side of the truth. There are cases where high blood pressure cannot be cured, but it can absolutely be controlled. And for most people, that's not bad news. Because even if the root cause isn't reversible, managing your blood pressure can still add years to your life and prevent serious complications. 1. Genetics and aging. If high blood pressure runs in your family, or if you developed it later in life due to age-related changes like stiff arteries or decreased kidney function, there's a chance it may not go away completely. Your genes may make you more salt-sensitive or affect how your blood vessels respond to stress and inflammation. But here's the catch. Genes load the gun, lifestyle pulls the trigger. Even with genetic predisposition, you can delay the onset of hypertension, reduce its severity, avoid or minimize medication, live free of symptoms and complications. You may not cure it, but you can outsmart it. 2. Long-term or advanced hypertension. If high blood pressure has been uncontrolled for many years, it may have already caused damage to the arteries, enlargement of the heart, kidney impairment, nerve dysregulation. In these cases, your body may have reset its baseline to higher pressure. Bringing it down is still possible, but a full reversal may not be realistic. The focus then becomes prevention of further damage, improvement in quality of life, and reducing risk of heart attack or stroke. And the good news? That's 100% achievable with the right habits and support. 3. Controlled not equal to dependent. Many people think, if I can't cure it, I've failed. Not true. Being able to control your blood pressure, whether with or without medication, is a huge win. It means you're avoiding complications, reducing your overall cardiovascular risk, living a longer, healthier life. Just like someone with glasses can still live a full life without curing poor vision, someone with well-managed BP can thrive. The mental shift that matters. Instead of asking, can I cure it? Try asking, can I control it? Can I reduce my risk? Can I improve my health? Can I live a full life without fear? If the answer is yes, you've already won. Final thoughts. So can you cure high blood pressure permanently? The truth is both hopeful and realistic. For some, especially those with secondary hypertension or early lifestyle-related cases, the answer is a confident yes. With the right changes and support, blood pressure can return to normal and stay there without meds. For others, especially those with genetic factors or long-standing damage, a full cure may not be possible, but powerful control absolutely is. The most important thing is this: you are not powerless. Every bite you eat, every step you take, every stress you reduce, all of it matters. Instead of thinking in black and white terms like cured or not cured, focus on this question. Am I doing everything I can to give my body what it needs to heal, adapt, and thrive? Because whether it's permanent remission, reduction in meds, or simply slowing the progression, the results are life-changing either way. Now we want to hear from you. Have you been able to lower your blood pressure naturally? Are you working toward remission? Do you believe it can be cured in your case? Drop your story or question in the comments. Your journey might inspire someone else. And if this video helped clarify things, don't forget to like it, subscribe, and hit the bell so you never miss our next evidence-based guide to mastering your health. Because your story with blood pressure doesn't have to be written in stone. With knowledge, action, and support, it can be rewritten for the better.